All right, the recording has now started. Good afternoon to all colleagues, and thank you once again for joining the Introduction to Systematic Reviews workshop. I'm just going to shortly read Dr. Miriam's bio and then hand over to her to facilitate the session. My name is Ms. Tebogo Mokoko from the Postgraduate School at the Research Capacity Development Unit. So Dr. Miriam Oyedeji Amusa is a postdoctoral research fellow at the Botany and Plant Technology Department at the University of Johannesburg. She has over 13 years of professional experience, and her journey in academia and research has been marked by exceptional achievements and a commitment to positively impacting society. Dr. Marion's academic journey began with a bachelor's in plant biology from the university in Nigeria, where she graduated as the best graduating student in the Department of Plant Science. She further honed her expertise with a master's in pharma. Ooh, Dr. Miriam, look at me now butchering the words.
Pharmacognosy.
From the university in Nigeria, where she conducted research on antimicrobial activity of Nuclear latifolia, showcasing her early dedication to exploring the medicinal properties of plants. Continuing her academic pursuits, Dr. Miriam obtained a PhD in botany and plant biotechnology from the prestigious University of Johannesburg in South Africa. Her doctoral research focuses on the multidisciplinary study of South African Malaysia, delving into Elysia. I must say it's quite interesting to always learn about other people's background. I'm from social sciences or rather humanities. So it's quite fascinating to get to learn how you pronounce all these words. And I presume they're in French or Latin?
Latin.
Latin, knew it. But yes, delving into indigenous plant extracts, medicinal properties, and potential therapeutic applications. With that said, we've learned a bit of Latin today. Thank you. So I will now hand over to you, Doc, to then start with the session. Thank you very much once again for availing yourself for this workshop.
Thank you. I'll share my. Let me share my screen now. Is it visible? Hello.
Yes, it is. Thank
Mr.
you.
Bogo, is my screen visible?
Yes, we can see you and we can see your screen. Thank you.
All right. Thank you, everyone. Good afternoon. As earlier introduced, I'm Dr. Miriam from University of Johannesburg. I will be speaking on an introduction into systematic review. The workshop is actually on systematic reviews and meta-analysis, and which will be facilitated by 4 postdoctoral fellows. But I will start today and on Friday with the introduction and how to formulate our questions. I hope you enjoy as you go along with us. Yeah, looking at our systematic reviews, the objectives of this theme is to introduce us to systematic review and also to facilitate on how to formulate an answerable research question. Also to look at how do we determine our inclusion and exclusion criteria, which will be facilitated by Dr. Tsepo, and also the searching for evidences, extracting data, and assessing the risk of bias, which will be facilitated by Dr. Zanki. Yeah, today being the first day, today, someone said you can't hear me. Am I audible? Hello? Mr. Pogo, can you hear me?
Yes, we can.
All right, because someone said you can't hear me. I can see a message there now. Okay, it's fine, but please, in case you can't hear me, let me know so I don't know. Yeah. So being the first day, so I would like to start this systematic review with a this session with a question. I will appreciate if participants can actually participate in this question. My first question is, what are the types of reviews you know? You can actually unmute, or maybe you can put in the chat box. Let's just make it a discussion forum, because I know most of us have been writing reviews, because I know most people here are postgraduate students, PDRFs, they have written a lot of reviews. Yeah. So can we just say, what are the types of reviews you know? Then also, what type of review do you write? Anyone?
Hi, Prof. I only know of two, a normal literature review and a systematic one. So,
yes. So someone has also written narrative review and systematic review. Perfect. Yeah. Which type of review do you write? Which one do you enjoy writing? Anyone? Can we check the chat? All right. So from what I have seen, some people have talked about narrative review, systematic reviews. Then I think what most people write is narrative review, or let me say what most people enjoy writing is narrative review. Yes, systematic review and meta-analysis. I can see I enjoy writing a narrative review. Yes, I can see comments. Yeah, people are coming. Yes. So first time writing a systematic review, fantastic. Yeah. All right. Thematic and chronological literature review. Yes. Yes. Yeah. We have lots and lots of reviews, but we are going to see now as we go on, what are the differences between these reviews? Why should we write a systematic review? Why not just stop at just a narrative review? So from my slides, I've tried to put up a slide showing types of reviews. Although we have lots of reviews, but this is just a few of the types of reviews people write. Narrative review, critical appraiser, scoping review, rapid review, and systematic review. Systematic review, I have included plus or minus meta-analysis, meaning systematic review can either come with a meta-analysis or come as just a systematic review without a meta-analysis. So if you want to look at these reviews in terms of speed, methodological detail, risk of bias, and how comprehensive it is, comprehensiveness, we look at it with this arrow from narrative review. Depending on the area of research, like it depends on your research area, you notice that from narrative review down to systematic review, the speed when you're writing a narrative review is very fast, a critical appraiser, scoping review, but when it goes down to a systematic review, it's slow. As we go on, we see the reason why this is like that. Also, for the methodology. For narrative review, you don't really have a method. You can just go to your Google, search your topic, use your Boolean operator, search your topic, put some data together, then you can start your review. It's got fewer methods compared to when you go down to a systematic review. Your methods needs to be more explicit. As we go on, we see what I mean by this. Then when you talk about risk of bias, when you come to your literature narrative review, there's high risk of bias in narrative review, because you can just easily decide you want to choose some papers, maybe just 5 or 10, then you're fine. Then you can go on with those papers, compared to, which is when you compare that to a systematic review, that is not the case. Hello? Did you say something? Okay. So when we look at systematic review, we have to include the risk of bias is being measured when you talk about systematic review. So you have a very decreased or low risk of bias when you are writing a systematic review, because systematic review is a process. And as we go on, you will understand what I mean. It's a process, and in each of these process and stages, there is always a stage where you need to measure your risk of bias. And when you talk about it being comprehensive, the narrative review depends on the author. You can decide how lengthy you want your review to be comprehensive. You can decide, okay, no, I don't want it to go more than this, or I want it to be more than this. But when you talk about a systematic review, it has to be very, very comprehensive, because it's our aim for writing a systematic review. It's actually for policy making and to decide some critical stage of real research. Then looking at the 4 most common review types, this is adapted from Grant and Broth in 2009. We can look at traditional narrative review, rapid review, scoping review, then systematic review. When you look at the time frame for a narrative review, maybe 1 to 4 weeks, a month, you are done. And how many reviewers, how many people need to write a systematic review? There, just 1 person is fine. You can write a narrative review as just a person. But when you talk of rapid review, you can be 2. Scoping review, you can be 1 to 2. It doesn't really matter. But when you talk about a systematic review, at least 2 people must be involved. At least 1 person cannot write a systematic review. Just the major aim is to measure your risk of bias. Of course, when 1 person is writing, you can either decide, oh no, I want to include this, I don't want to include this. But in systematic review, it's not like that. You need to include everything at every stage, and the biasness needs to be measured between 2 or more people, and it takes more time. As we can see from the slide, it takes like 8 months to 2 years. It depends on the activeness of the team involved in writing this systematic review. So I'll come to this and say, what is systematic review? Looking at what is it about, why is it necessary, why is it preferred to other reviews, then why should I conduct a systematic review? Can anyone just give explanation or maybe a definition of what you understand by systematic review? Some people said they have written systematic review before, they've enjoyed writing systematic review. Can we just put in the chat box, what do you understand by systematic review? Putting these bullet points in consideration. Anyone? Yeah, anyone from the chat? What do you understand by systematic review, or what can we call a systematic review? Okay, critical studying of a given topic. Yes, fantastic. Yeah, anyone else? Okay. It's following a systematic process or critical reviewing. Yes. Mr. Poco, I can't find my slide anymore. Hello, Mr. Pogo. Hello? A systematic review is a scholarly synthesis of the evidence. Yeah, like I can't find my slide. Right. Okay. All right. Okay. Is it visible now? Hello? Hello? Hello?
Yes, it is visible.
All right. So I have put up some definition for systematic review with a clearly articulated object. It follows. Okay, I've seen different lots of there are set methods to conduct this type. Yes, 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 yeah. All right. Thank you so much. So from my side, I would say I've tried to put up some definitions for systematic review, one from the Cochrane Handbook, one from Wikipedia, one from Center for Reviews and Discrimination, and one from the US Department of Health and Human Services. If we look at from Cochrane, Cochrane has said it's an attempt to collate all empirical evidence that fits the specified eligibility criteria to answer a specific research question. It uses explicit systematic methods that are selected to minimize bias, thus providing more reliable findings from which conclusions can be drawn and decisions made. But when we look at the one for Wikipedia, Wikipedia has said it's just a literature review which focused on a research question that tries to identify, appraise, select, and synthesize all high-quality research evidence relevant to that question. US Department of Health and Human Services has said it's a critical assessment and evaluation of all research studies that address a particular clinical issue. The researchers use an organized method of locating, assembling, and evaluating a body of literature on a particular topic using a set of specific criteria. And from Center for Reviews and Discrimination, it says it aims to identify, evaluate, and summarize the findings of all relevant individual studies, thereby making the available evidence more accessible to decision makers. Adheres to a strict scientific design based on explicit, pre-specified, and reproducible methods. But I would say, I would go with these three definitions, but there's a flaw with regards to Wikipedia. I will not go with this definition for Wikipedia because systematic review does not only take into consideration all high quality research evidence, it brings all research evidence. When you're writing a systematic review, you have to bring in all research evidence pertaining to your topic. Not that when you get your references, then you can now say no, because this study was done in maybe I'm writing this study in South Africa, in Africa, but maybe this study was done in Europe. No, I want to exclude it. No, as long as the study is relevant to your topic, then you have to include all studies, not just the high quality research evidence. You have to include all evidences based on your study. Now we are going to look at the keywords in this definition to give an insight of what systematic review is actually about. Looking at the keywords, I have put the keywords in bold. From the Cochrane Handbook, you'll see that for systematic review, it has to be a pre-specified eligibility criteria. It must be explicit, and it uses a systematic method. Your findings must be reliable. It gives you a reliable finding at the end of your research because it minimizes the biasness. And it's also very good to draw your decision at the end of the review. Also looking at Wikipedia, it has said that you can identify your question, appraiser, select, and you can synthesize all research evidence pertaining to your question. US Department, you can see it's a critical assessment. It is a very critical assessment of your topic, whatever topic you are dealing with. A systematic review gives a critical assessment of evaluation, and it organizes your data. You have to organize your data, locate, assemble, and evaluate whatever findings you get on your topic. You identify, you evaluate, you summarize, and at the end of the day, what do you need to do? You can use your results to form your decision on your specified topic. Now, what is meta-analysis? Meta-analysis is the use of statistics to summarize your results. Okay, let me say systematic review is a qualitative study, while meta-analysis is a quantitative study. I think it's much explicit that way. And it also provides more precise estimates of the effects of healthcare than just an individual study. Meta-analysis also facilitates investigation of the consistency and differences of evidences across studies. After making your systematic review, okay, I will come back to that. It is used to quantitatively analyze results compared to systematic review, which gives the qualitative interpretation of your results. As I said earlier, not all from this little Venn diagram, not all systematic review comes with meta-analysis. Meta-analysis is just a subset of a systematic review. There are some systematic reviews that do not need to further into a meta-analysis, like something like might just be a narrative systematic review. But when you talk about the systematic review that needs to go with a meta-analysis, then it's just a very few part of systematic reviews that really require meta-analysis. And when you are talking about studies, for instance, those in the health section, you might be talking about studies and comparing your studies to placebo, like some drugs comparing to placebo or comparing to other drugs, or you want to see the effect of some drugs over the years on a particular disease or a particular ailment. You are looking at the effects of these drugs. Definitely you can go to meta-analysis, because now meta-analysis, after your systematic review, meta-analysis can now bring these results together and let you see that, okay, fine, they've been using this drug for maybe 20 years. And how has these drugs been effective against this specified disease or ailment or things like that? Then from a meta-analysis perspective, you can see and you'll be able to analyze that, okay, fine, this drug or this medication has been effective from so year until this year when it was no more effective, or it was not effective, or the effectiveness have not been that much from the beginning till now. Then you can draw your conclusion and say, fine, from these results, we can see that the effectiveness of this medication over the years has been maybe 50%, but now it's 80% or 100% or things, or otherwise. You might even draw from the conclusion that, no, this medication has been like this for maybe 20 years, but now we can see a drop in its efficacy. So maybe you can now draw your conclusion and say, no, we need to try another option since this medication is no more working for this ailment. So that is just the essence of meta-analysis. So not because people think immediately you think about systematic review, you definitely need to join in with a meta-analysis. No, it's not all systematic reviews that require a meta-analysis. Now I will come to why do we need to write a systematic review? Why there are lots of reviews, so why do I need to write a systematic review? There are increasing emerging evidences, like people do research every day, every time, depending on your field. Anyway, there are some fields that if you search for your topic today, maybe you have like 20 journals out there. If you search the same topic tomorrow, it might have increased to like 25 or 30. It depends on your research field. But most research fields have increasing and emerging evidences every day. So for a systematic review is really important so that it can bring all this together for policy makers, and also to see your gap in research, to form a research question. The time constraint, there's always a time constraint to read. How do I have to take all these papers, all these journals to read all these before I can draw my conclusion or something like that? But before I can know the type of research to do I need to read this, read that? But if there is a systematic review on your set topic, you can get that systematic review and read through it. The systematic review supposedly must have brought together all research in that field to give you a gap where you can now look into that. Okay, this is the gap where I can come in as a researcher, and you can develop your
Dr. Miriam,
research question. Yes.
Sorry to cut your word. Are we going to take questions as we go along, or are we going to wait till the end of the session? Because I see we already have a few questions in the chat.
Okay, I was not okay, maybe okay. Do you want us to take it as we go?
I think that might be a good thing, so that the participants are answered as we go along. Unless you're going to deal with it later on. But I see, is it Sabe? Okay, that's just an answer, we can see it. Helen's hand is also up.
All right.
So Helen, perhaps we can allow you now to come in and ask your question. Helen?
Hello, good afternoon.
Afternoon, Helen. You can ask your question for Dr. Miriam. I'm not sure what's going on. Dr. Miriam, perhaps you can proceed, and then when Helen. Okay, there's Helen and there's Gibson. So if you can ask the questions and proceed, thank you.
Yes, thank you very much, Doc, for your presentation. But I have got a question on your previous slide that you showed us about the time frame for various types of reviews. I'm a bit worried now with the time frame that you indicated for systematic review, whereby you say you need about 8 to 2 years carrying out a systematic review. So it's clear.
I said something that it depends on your team.
Yeah, but it's clear that
like it depends on the team. Like okay, for instance, let me give you an example now. I have a team. I've got different teams where we write systematic reviews. I have a team. We started the systematic review, was it in January or December? But we are all busy. It's a team of postdoc and PhD students somewhere. So we only meet once a week. You understand? So that's what I mean by it depends on your team. If you've got teams that are hands-on, you can finish your systematic review in maybe less than 2 months. But if you've got teams like your team members, what I mean by your team members, maybe they are so busy, because every step in your systematic review has to be recorded. You cannot jump a step. As we go on, you will see, I will still tell you about the guidelines. There are guidelines to write systematic review. You understand? So imagine you have a team. We know we are all students. You understand? We are all students. I'm just writing this systematic review. It is not my, for instance, for a PhD student now, it is not my, it is not part of my project. You get what I'm saying? It's not practical, but I want to write this systematic review on this topic. So you have come up with your colleagues and say, okay, let us do this systematic review. Imagine how much time do you have to put into it. If you've got enough time to put into it, then you'll be able to make fast move. But if you've not got much time, unlike just a traditional narrative review, you can just say, okay, this is the outline of our review. Mr. A, give us the introduction. Mr. B, writes on the methodology. Mr. C, writes on this, then we conclude, then you are done with your narrative review. But that is not the case with the systematic review. You have to do things individually, then you come back again and you have to deliberate on it. What have you done? Okay, we need to decide. We need to reach a compromise. Okay, why are you saying this? Why are you saying this? There's a flow chart to follow. You understand? There's always a flow chart to follow. There's always a method to follow. How do we comprehend this? Then how do we agree at every stage? That is why I said it might take a long time. But if you have members that are hands-on and working every time, no, it will not take up to that. Have I answered your question?
Thank you very much. Thank you very much, Dr. Yes, you've answered me.
Thank you.
Good afternoon. Sorry, Dr. Mariam, I think I had a problem with my sound. Am I audible now? Yes, so my question is, earlier you talked about the fact that for systematic review, there has to be a certain criteria that the literature has to meet. I don't know if you're going to unpack that, because I have a question that I'm trying to do a systematic literature review on a certain topic, but when I try to do the search, I'm only have like 5 relevant articles. Can that be suitable for a systematic review? Or is there like a number of articles that if you have maybe 30 or 50, then that qualifies? So I think that is just where I needed clarity on.
Okay, thank you so much. No, in fact, 5 is enough. There is a review. There's a review. I have a team. We are writing a review now. One of my teams. We are working on just 2 articles. We got just 2. But you must have searched a wide range of databases. You understand? Because while writing a systematic review, the aim is to bring together all study that has been done in that specific field or your study. You understand? So for instance, if you have narrowed down your databases, maybe you have only checked 2. It depends on your search. You understand? Have you searched just 2 databases, or you've limited yourself to just 3? When you write a systematic review, then a reviewer can pick it up and say, no, but this person, I wrote something on this topic, so this person did not include this. Do you understand? Or I can pick it up to read. Remember, you are also writing for the audience. Then a systematic review is meant to draw for policymakers, for decision makers. You understand? It's meant to be used by the public, researchers to decide on what they want to do. Now, if your systematic review is narrowed down and is not bringing in all relevant study in that field, then it's not a systematic review. We talked about a narrative review. A narrative review, you decide how comprehensive you want to make it. You understand? But when it comes to a systematic review, it has to be very detailed and comprehensive. So I think if you have searched all necessary databases that are relevant to your field, and different Google, different types of databases, if you have searched and you are sure that you cannot get anything more than 5, it is only those 5 articles that suit your inclusion criteria. There's something we call inclusion and exclusion criteria. If you have said and you are sure that it is only these 5 manuscripts that meets the inclusion criteria, and remember, a systematic review cannot be done by just one person. You know, your team members must have decided that, okay, looking at all the papers we got, these are the 5 that suit our inclusion criteria, because the inclusion criteria must be determined and be assessed before you start a systematic review. You must discuss, what are we going to include in this topic? What do we want to include in this topic? What do we want to exclude? You understand? So if you don't have anything more than 5 and the team members have discussed, deliberated on it, and you don't have whatever, yeah, you can go ahead and write it. There's nothing you can do. I hope I answered that question.
Yes, thank you for the clarity.
All right, thank you so much.
Dr. Miriam, before we proceed, there's another one. And
right.
Lynn is asking, does your supervisor count as the second researcher?
The problem I have with that is, you know, we know how it is with our supervisors. The supervisors, if you and your supervisor are writing the systematic review, it would be advisable if the supervisor can also be involved in the process. You understand? If the supervisor can be involved in the process, then fine. By the time you start looking at your data, before you include your papers, you have to remove your duplicates. After removing your duplicates, you have to check your abstract and the title for your included papers. Now, these are done individually. You understand? When you're screening the literature, it's called screening of the literature. Okay, this I'm meant to talk about it on Friday anyway. When you're screening your literature, you have to screen the literature independently. Then you come together and harmonize. But now, if your supervisor is not involved, then you be the one to do the job alone, which will definitely include some biasness. You understand? So a systematic review is meant to cut out all bias. So that is why it has to be 2 or more. So maybe if you have your supervisor and your supervisor does not want to be involved, you understand, maybe you can now you can have maybe one of your team members, like in your group, then the 2 of you with your supervisor being the 3rd person, like just your supervisor's name, then but at least 2 of you can come together and write it, and it makes it very interesting. I don't know if I've answered that question.
Okay, so Christlyn has a follow-up, but yes, you can go ahead. I see we also have Miriam, another Miriam, who also wants to ask
All right,
question.
yes.
So, perhaps let's do Miriam and then come on to Christlyn. Yeah.
Good afternoon, everyone. It's actually a follow-up to that question regarding authorship that you really need to discuss with your supervisor or host before bringing in another team member. It's not all the hosts or supervisors that are interested in especially because of the funding or scholarships. They might not. So before you go ahead with writing a systematic review, if you are not writing with other people that is outside the scope of your work, you really need to sit with your supervisor if they will agree to do this with you to avoid the biasness. And if they will not, will they allow you to include another person in the team to work with you? So it's something you really need to do with as a student or a researcher. That's my comment.
Thank you so much for that. Yeah, you really need to speak to your supervisor with regard to that, if he or she will allow a collaboration with your team members. Of course, they will definitely want you to maybe bring one of your team members, like those of you in the same group. They might not want you to bring someone from another group or something. Yeah. Otherwise, he or she can get involved in the systematic review. I think after screening your data, like when you finish after the first stage is where you decide your topic. After your topic, you have looked at your objectives, you have set your PICO, you have your references, then you have screened your references, you understand? Because it's actually the references now. You have screened your references, then you have now arrived at a point that, okay, these are the references we are going to use. Then when it comes to writing, of course, your supervisor can leave you to write. But from the beginning, the process from the beginning, you have to do it together if he or she will allow you to do that. Yeah. So, Mr. Poco, can we go on?
Yes, I think we can. As part of that, she says, thank you, that makes sense. Okay, I think we've answered everyone's question for now. We can proceed. Thank you.
All right, thank you. Okay, so as I was saying that, why do we need to write a systematic review? I was talking about the time when you have a topic, you want to decide what topic do I need to, maybe you want to research, you want to go for your PhD, or you want to go for your master's, you want to embark on a research. But now you're thinking, where do I go? What topic do I come in? What problem do I want to solve? What is the problem? Things like that. When you get hold of a systematic review gives you an overview of what is available on a particular topic. And you can as well decide that, okay, this is the gap from all the studies that have been done, rather than you have to download 50 papers and start reading, oh, what is this? What is this? What is this? No. A systematic review gives you a quick grasp of what is available on a specific topic. And there's, as we have said earlier, there's increase in knowledge in a particular field, in different field. There's always an increase in knowledge, things like every day people keep growing. So there's always a need for systematic review to put all this, to harmonize all this research and have something that can just be at a glance. Then, if you have a very good research question, if you've said formulating a research question, that is what we'll be talking about on Friday. If you have a very good research question, then a systematic review is advised on that topic. Also, when you want to bring together multiple studies on a particular topic, multiple studies that have been done, it's very easy to do a systematic review to bring these things together. Also, when you have conflicting studies, conflicting results, a negative result is a result. Where you have conflicting results on a particular topic, maybe you've done other papers, you can see, oh, this is this, this is this, this is saying this, this is saying this. Then the next thing to think of is if you can have a systematic review, can bring these studies together. All right, then I will also say life is full of complex decisions to take. You want to take a decision, it's so complex to make a decision. What do I go? How do I do this? How do I do this? Then you think of a systematic review. Systematic review will make you take a decision on a particular topic. And also in the healthcare, also when there's dilemma of medical decision making. So where you have poor data, which affects the ability to make the right decision. Then when you have patients who need help for medical help, they need to pay high bills and things like that. But when you have a systematic review, which has actually compromised or brought together different problems and treatments and things like that, then you can see from a systematic review in the health section, we definitely go with a meta-analysis which has looked into the effectiveness of the medication that have been used in treating the ailments, the new ones, the old ones. What is the outcome? Is it possible to use this? Can we use this? Can we go on with this? The systematic review really helps in making this decision in the health profession. Insufficient evidence can cause harm, because by the time you you have the evidence that are not sufficient enough, you cannot just draw a conclusion from it. But when you have a systematic review, which has brought lots and lots of studies together in just a study, then you can see from the outcome of that study, and you can be able to make decision on what works best for you. Then also in science, in scientific studies, you've got numerous published articles, as I've said earlier, depending on the field of study. Numerous published articles on a topic. You want to decide then, how do I go about this? Where do I come in? There's inability to manage information from individual studies because of what? Biasness, methodological flaw, time and context dependence, misinterpretation, and variation in conclusions from different studies. But when you bring this thing together, you can synthesize, and there can be an existing systematic review that can bring these studies together and give you an idea of what to come up with. Rationale for systematic review: it needs to bring together and synthesize all available evidence on a topic, which will lead to evidence-based guidelines and policies. As we have said, systematic review, it's actually makes for policymakers, for research, for you to decide a gap in your research, for you to take a decision at the end, to separate sound and unsound evidences. By the time you bring all the papers together after writing a systematic review, you can see that, okay, these evidences are genuine, these evidences are not genuine, these evidences are flawed, and while these are okay. And it's also efficient use of resources, and it can also reflect on the need for further research. By the time you bring all these studies together in a systematic review, as I have said earlier, you can come up and say, okay, this is a gap we need to follow or we need to fill. Benefits of systematic review. When I say time saving, you want to come up with a research topic. You want to do research. You don't know what to do. Do I need to start searching all papers, reading all papers to see that, oh, okay, this is the gap, this is the gap? No. But if you have a systematic review in that particular topic of yours, it will save your time in having need to read various publications. You can just check and say, okay, fine, this is a systematic review on this topic. I can go through it. Then I can easily identify the gap in research. Cost effective when you talk about making decisions, making policies. Instead of wasting your money on trials and things like that, a systematic review would definitely give you a glimpse of which direction to move towards. To the right decision, you can choose your right decision on what works and what does not work for you. You can also have a further part on the evidence, and you can grow in scientific methods. The major goals of a systematic review is to appraise the quality of the existing studies, because now you are bringing together all existing study in that topic. So you want to see the quality of those studies, then which will now inform your own decision. Then also to provide a high quality summary of the underlying evidence of what you have on ground. Who are the people who use systematic reviews? Researchers, patients, or the public? Sorry. Researchers, it makes, you can, as I've earlier said, to determine the gap in studies and to formulate your further research. Patients, it makes it best informed choice of alternatives. When the patients and the public, they can use it in the medical sector to inform the choice of alternatives for medications to use. The policy decision makers, policymakers, it helps the policymakers to decide and to have an evidence base to formulate their policy. Practitioners, it helps to develop a guideline. It also helps to inform an evidence-based practice. instead of now they don't need to start looking for different evidence, but once they get hold of a systematic review, they can draw their policy from that. Now we look at the growth of systematic review. I tried looking at the growth of systematic review from 1983 to 2002. As you can see from the graph and the year of publication, from 1983, it was just 3 to 1987, just 3. From 1988 to 1992, we can see the increase to 20. Now 1993 to 1997, 42. Hello? Hello?
Dr. Miriam?
Hello?
Yes.
Yeah, I could see you are posting another link. I was thinking
no,
I was logged out.
No, no, it's for the evaluation form. You can still proceed. Thank you.
All right. Okay. So from 1998 to 2002, it increased to 110. From 2003 to 2007 to 248. Can you just the increment? Then we can see from 2018 to 2023, 1,105. This is from PubMed search. Search from PubMed systematic reviews. It will give you the growth of systematic review. So you can see that people are now tending to appraise systematic review because of the benefits of a systematic review to the society and also to researchers and policymakers. Yeah, so now we go to the steps in conducting a systematic review. Very short and simple. For a systematic review, the first thing you need to do after getting your team, like it's, as I told you, it's from two or more people have to be involved in a systematic review. So the first thing is the team needs to agree to formulate a question. So this how to formulate question will be our next discussion on Friday, which is the day 2 of this systematic review journey. So how do we formulate our question? What do we need to put into consideration before formulating the question? How do I get a good research question that can, how do I answer, that can be answerable? Yeah, let me say formulate an answerable research question. What do we need to put into consideration? How do we go about it? This and that. We'll talk about this on Friday. Then the next is to develop your protocol. Your protocol might or might not be published, but it's advisable if you can publish your protocol after formulating your question. It's advisable to develop your protocol, and it's advisable to publish your protocol. If you publish your protocol, it just saves you time. So then when you publish it, it's online. So if any other person is thinking about writing the systematic review, then at least yours, no matter the amount of time you and your team members are using on it, then you know that since your protocol has been published, nobody can also write on that topic again. You need to follow up and finish the systematic review you have started. Then you also have to, after that, you now have to identify the eligible studies. How do you identify the eligible studies? After formulating your questions, I won't want to say much about this because then I will be talking about our discussion of Friday now. So you identify your eligible studies by searches. After searching, you download your references. You make sure you search an ample amount of databases, especially including databases that are specific to your field, to your area. Then also the gray search engines as well, so that you can now have a good amount of studies. Then when you have these references, of course, you will have both. You will have references that are eligible and non-eligible references. So that is why you still need to go to the screening phase. You need to screen your references. You need to screen the studies that have been collected. You screen through your abstract. Now you can see this is why we need 2 or more people. You need to screen your abstract because the way you look at a topic, you might feel, no, this should be included in my topic. But at the end of the day, the second person might feel like, no, this topic does not answer our question, so we have to remove it. But you need to come back together, and you have to decide, do we include this study or we don't include this study? Why? Then the reasons should also be stated out. Then you move to your, then you also need to screen. After screening using the title and the abstract, now you need to screen using your full text. Each member, it's maybe 2 or more members, you need to check the full text, to read it, to see, okay, fine, we are going to use these studies, or we still want to exclude. Because even after excluding using your abstract and the title, that does not end the exclusion. When you get to the reading of text, at that point, you might still need to exclude some studies that are not eligible. Even when you get to data extraction, by the time you start extracting your data, you might notice that, no, this is not what we actually wanted. So you can still exclude at that point. After excluding, then you need to do the appraisal study, like the quality of the papers you have included. All this needs to follow, and all this needs to be taken note of, because in your methodology, you need to put all this down in your systematic review so that it will be reproducible. Another very important property of systematic review is reproducibility. So once there's any fault in your methodology, then it's not going to be reproducible. But for a systematic review, when I see your flow chart, I should be able to follow the flow chart and go through whatever you have done on the said topic. Then you now have to synthesize the evidence that you have collected from your systematic review, from the papers you have put together. Then you can now interpret your findings. You interpret your findings. You want to use graphical methods. If it is a research that needs to go to meta-analysis, you take it to meta-analysis, you do your meta-analysis, you interpret your questions. After that, you can now start your writing, which will be easier, because by now, you have interpreted all your results. You have if you are going to use your charts, if you are using your graphs, if you are using your maps, if you are using different things to analyze your results, you must have finished analyzing your results. Then you can now write based on what you have written. So yeah, I think from here now, I think I am done introducing what a systematic review should be like. Then on Friday, we'll move to how to formulate an answerable question. Today is just to introduce us to what a systematic review is meant to be.
Thank you, Dr. Miriam.
I would say thank you for listening. Yeah.
Thank you too for facilitating. I see we've got a question from Faith Matole. She says, may I ask if the protocol is a process-like methodology, and then Xolile will come afterwards?
You said if the protocol is what?
Is a process-like methodology.
Yeah, there's something we call Prisma. When I talk about this on Friday, I have it on my slides. You understand? You can actually read about the Prisma guideline for writing systematic review and meta-analysis. But I will talk more about this on Friday. If I start going in depth into it, then there's nothing to talk again on Friday. So yeah, I've got those things on Friday to tell you about the protocol. The protocol is not just methodology. When you want to publish your protocol, it's just like there's a short introduction of what you want to write about. You understand? What you want to, a short introduction. I will also share a link on Friday. I will share a link of published protocols. You understand? Examples of protocols that you can also look and see what it really means and what a protocol really requires. I've got those links. I will share with you on Friday. There's no problem. Then you can really understand. It's just like a short description of what you want to do and what your study is about. Do I answer that question?
Okay. Yes, seems so. Faith says she will log again on Friday.
Yes, I will share the
There was
links
a
to that on
hand.
Friday.
There was a hand. Olile, are you still here?
Well, good day, Doc. Good day, everybody.
Good afternoon.
I'm far away, but I'm just new in my studies. But I just want to find out if did I capture this section. If we are working in the academic, and then we are writing a paper, one of them is the main author, others are just co-authors. Is that systematical review paper that one? This is just one. This is my question.
Yes, thank you so much. I think, yeah, you said you're far away because we answered this question earlier. A systematic review should be written by at least 2 people so that you'll be able to measure your risk of bias. So, like someone asked, because we know how it works in maybe a PhD or master's, or like when you are under a boss, like you just be the one to write, then your boss will just be a co-author. We know that is the way it works. So we are saying that if you need to write a systematic review, it's better to discuss with your boss if he or she can be involved in the early stage, at least to select and to screen your references. That is the most important stage where you need someone to screen your references, to formulate your topic and screen your references. By the time you get to the writing, after you have screened your references, you have collected the eligible studies, then you can continue writing. You understand? But now, if you are in that type of situation and he doesn't want to come in, then you can speak to him if one of your team members, of course, we all have team like your group or things like that, can definitely join. Then your supervisor can be the third author. But at least there are 2 people needs to be involved in the first stage of screening.
No, perfect, Doc. I understand it now. Thanks a lot.
Thank you.
Perfect.
Thank you so much. Yeah.
Okay, Dr. Miriam, the other Miriam is asking, is there a difference between meta-analysis and bibliometric analysis?
Yes, there is a difference between meta-analysis and bibliographic analysis. Okay, I think maybe by Friday I will put up. We don't really want to go in depth for the meta-analysis, but maybe just a picture to show how Cochrane. Then you can also check the Cochrane handbook. You can check the Cochrane handbook. You'll see more about meta-analysis. Meta-analysis is different from bibliographic analysis. It's totally different. Yeah. Do I answer that question?
Miriam, have we answered that question for you?
Yes, yeah, it's okay. Just trying to clarify in my mind where the systematic review may
You can check the Cochrane handbook.
Okay, no, I'm just saying now the meta-analysis that's not we might not have all the systematic review to be included in meta-analysis. That's where I'm actually going. That we might
No.
no.
I'm saying it's not that not all systematic reviews get to meta-analysis.
Okay.
But for a meta-analysis to occur, you need to have done a systematic review. Do you understand? I don't know, maybe you get me. Like, not all systematic reviews get to a meta-analysis. Okay, for instance, there's a topic we are talking about plants now. There's a topic on Friday. I will share some topics which I've put on those slides anyway. There's a topic like, for instance, those of us in plants, ethnomedicinal uses of maybe ethnomedicinal, okay, let me say medicinal plants used for skin diseases in Nigeria. This is more of a narrative systematic review. What questions am I asking myself? I'm asking myself that, okay, what are the plants that are used in Nigeria for treating skin diseases? Then I'm asking myself again that, okay, these plants, do they have similarities? Like looking at Nigeria now, I want to look at different states. Do we have similarities in the use of these plants in different states? Then I want to see how have they validated these plants against these uses that have been recorded. There's nothing meta-analysis in that. But now, when you are looking at the effects of a particular drug, comparing it to a placebo on a disease or on an ailment, now you want to go for a meta-analysis, because now you have an intervention, you have an intervention that is administering this drug that you are talking about. Like you have a particular drug you want to write about, you have an intervention, you have a comparison, you are comparing this drug to a placebo or something else, you understand, in a patient. Then this will definitely go to a meta-analysis, because now you have, like I said, it's a quantitative assessment of your data compared to a qualitative assessment. Now you have maybe from so year, you can have a year limit, maybe from 1989 or 2000, this drug has been used like this. Then when you do a meta-analysis from your forest plot, it gives you a forest plot. From your forest plot, you can see at a glance that, okay, this drug was effective on a scale of maybe 40% in 1988. But now when research continued, people have used more of it and they've researched on this drug, and by the year 2020, you have the efficacy to be like 60%. But fortunately, maybe now when you get to year 2021 or 2022, you can see more results. This meta-analysis will bring all the results together and it will show you the efficacy and how this has worked. Then you can see that, okay, at this stage in time, this was very effective and was very perfect. But that is qualitative, when you have qualitative data. So for you to have a meta-analysis, you must have started from a systematic review. But not all systematic reviews get to meta-analysis. Your whole topic might not need a meta-analysis. Then it's fine. It can just be a systematic review. I don't know if I answer your question. All right. Yeah, I think she has responded.
Yes, she has. She says, thank you for the clarification. Okay, if there are no further questions, I think we'll just give everyone about 2 minutes to still ask questions. But I think to get the rest of the piece of the pie, you need to attend on Friday, as our current slide states, on how to formulate an answerable question. And that is on the 18th of August from now 9 till 11. So that will be a morning session. So please do tune in to continue with this series. And I guess, Dr. Miriam, once everybody has attended for the full month, then they would be able to, gauge whether they are able to continue with everything that you have shared in the tips and tricks on how to go about their systematic reviews. As you've heard from Helen, some of people and Miriam, they're doing them now. So this will go a long way in helping them with their research currently. So just before we log off, we put a message in the chat to say that the Research Capacity Development Unit thanks you for attending the session, and that we ask that you please complete a 2-minute evaluation form to better help us to prep for more of these workshops. and in terms of our offering, but also for our grant reporting that is required. So without much waste of time, thank you, Dr. Miriam. Thank you once again to all our listeners or other participants for staying on until the end of the session. We shall meet again on Friday.
All right. Thank you so much for having me.
Thank you.
And thank you for listening.
Bye-bye, everyone.
Bye.